You are watching the DocTalk show.
Now that we understand what causes low back pain in the different age groups, what predisposes children to having low back pain even when they're older, what predisposes the middle age and the elderly. Let's understand, Dr. Mhumza. When people come to these orthopedic clinics, they come with x-rays, with all these CT scans that have been done, very expensive investigations. When a patient presents and comes and says, I have back pain, what processes do you go through to discover what has caused this back pain?
Thank you very much. One of our old professors used to say that you can actually get to find out what the problem is by taking a very good history. So finding out what this person has been up to or taking a good history of the condition is usually one of the biggest decisors on what the diagnosis is. And when you understand what the patient's problems are, then you can base on that to start your investigations. Your investigations can, depending on your line of thinking, can include blood work for the different ailments that you think. And the other one is imaging. And in imaging, that's where most people come in with x-rays. We've seen patients that have come in with heaps and heaps of x-rays, others with MRI scans, others with CT scans. But for starters, usually a plain x-ray is usually good enough to give us an
idea of what is happening.
What is happening before we can go any further.
But Darius, does everybody who has a low back pain really require an x-ray? Because we know if I come from some village, I may not be able to access x-ray services, these imaging services. Does everyone who has a low back pain require an x-ray? Dr. Mhumza has told us from history, we can actually find out what has caused this back pain. But
that is very true. So the role of the doctor will be to talk to the patient and find out what could have caused the back pain. It could be related to the work that he's doing, and that definitely does not need an x-ray. If they think the problem could be related to a disease that is coming from maybe a cancer or some infection, yes, there they can do further workup. So it all depends. It isn't that every patient will get an x-ray.
So from what the doctor has had?
Yeah, but you see, nowadays we have a challenge. Most of our patients always think that if you don't give them medicine, if you don't do an x-ray, if you don't touch them,
after they've Googled and realized,
especially after they've Googled, then you're not a good doctor. So they'll go doctor hopping
until someone sends them for an x-ray, CT scan, MRI.
Because that was the latest on the page that they had Googled. So that is when they'll start being satisfied.
You see, but people have to be aware that x-rays, or when we request for imaging, we only request if there is a strong reason to request for them. Because x-rays themselves are dangerous. They can cause so many problems.
So when we talk of conservative management of back pain, when they say, I have back pain, but let's try to manage it conservatively until we think you need something extra. So what is this conservative management? What does it normally entail?
Conservative management basically means, just like the word says, it's you're trying as best as possible not to be invasive. So meaning that you're starting with the basics, trying to reduce the pain and trying to bring the normal anatomy back to its
functionality,
its normal function. So conservative management will range anywhere from physiotherapy, sessions on posturing, analgesia, that is pain medication, so many different.
I've seen actually the people in offices, some very serious organizations will have chairs where most staff spend their time seated and working on a desk. They give them chairs and desks. They come and actually take your height and take how you're seated and ensure that your keypad is at a level where your back is safe and you're not posturing to to injure your back.
The whole point is to try and keep the spine all the way from the base of the skull up to the pelvis in one, in the actual plane in which it's supposed to be, not to create any malalignments of the spine. And these are some of the things that sort of tinker around with the spine and cause that small injury that will exaggerate into a chronic pain.
That longer. At what point should a doctor now seek specialized treatment from an orthopedic surgeon?
We've had patients that have come in 2 days of back pain. They want
that is especially when you have enough money to go straight to a specialist.
Yes, now especially now with the advent of insurance companies, so everyone would want to seek the best care at the
earliest opportunity.
The earliest opportunity, which is very fine. But of course, most of these conditions are managed by general practitioners as well. But by the time you need specialized care is when this problem has persisted for over 6 months.
6 months.
Yes.
Keyword 6 months.
That is like a chronic.
That is a chronic back pain, something that is not improving with the different things. You're taking your pain medications, you've adjusted your posture, you've done so many of the basic things, and that is when you need to seek some bit of specialized care to find out a bit deeper what exactly is going on.
What is the role of surgery? What happens? How does someone get to the extent? What's the worst that can happen?
Yeah, spine surgery on its own is very beautiful, especially if it's done for the right reasons. Not all back pains require spine surgery, but those in particular that have the thing that we are trying to remove from the spine, or trying to give the spine room to breathe. I would call it giving it room to breathe, because sometimes it's a bit compressed.
Taking it back to its normal state.
Taking it back to a bit of its normal state. Sometimes there are things that compress the spine from the back. I talked of some discs. There are some tissues and ligaments that the ones that as you grow older, they tend to just
the gel that we said, the ones that are no longer flexible, like the balloon with water.
That was the disc, but the ligaments start to become a bit rigid, and they are not as flexible as one was. So the spine tends to become a bit compressed. Those are conditions that actually a person would benefit from.
Dr. Darius, what is the worst that can happen to this patient? What complications can arise from this back pain?
So, like you said, back pain can be a very serious symptom. It can cause a lot of misery and disability to the patient. If they've imagine had this pain for months and months and months, and it's infringing, it's impeding your ability to work.
Not only to the patient, maybe also to the wife or husband.
To even have a happy life, you're always sleeping in pain, wake up, you're always in pain. That causes severe disability.
We know that when someone really gets sick for such a long time, they normally, especially if you're in pain, this affects your brain. So people get into depression because, like Dr. Darius mentioned, you are now disabled, you can't do what you can do, you're in chronic pain, and it ends up leading into depression. But we also have people who get posturing, who, I don't know, I know some people have tried to bounce during their youthful days, but then we have people who have not tried to bounce, but then they are either bending forwards, like, is that one of the things that happens with chronic back pain?
I'll start with the first one. It's a very big challenge. People get depressed because of the constant pain, like you had said. That you're managing with painkillers, and the person comes to you and they say, am I going to live on this medication forever? Which is a very big challenge. So some people tend to get into depression and these depressive states, and others get hooked onto some drugs, narcotics or opioids in this case. And those are some of the challenges that we see. Like you've mentioned, there's a particular part of it that is called ankylosing spondylitis. Very big word, but in essence what it means that the spine starts to fuse. Okay, so some people it can start early, and then other people it starts in much later years. But these are some of the changes that can result
Into.
as a complication.
You've mentioned that people ask, will I live on these drugs forever? So Dr. Darius, these people take so many drugs. There's polypharmacy, they're doctor shopping, they go here, they go here, and they're given drugs. Couldn't this also lead to side effects?
Yes, it's true. Drugs per se are toxins to the body. Drugs are given, they are ideally should be given for a short period of time to treat whatever is causing it, and it goes away. So but the trouble with back pain, especially the chronic back pains, the patient has to be on drugs for a very, very long time. And the drugs themselves cause injury.
So I know we've talked about a lot to do with this back pain monster. And with all these complications, it sounds like it is the end of life. But for sure, for those who have not yet gotten into chronic back pain or even getting acute, very sudden back pain that goes away quickly, we have ways of preventing this back pain. So when we come back after the break, we'll discuss how to prevent back pain and then the role of alternative medicine. People will not forgive us if we don't talk about this reflexology and these acupunctures and all that. So remember to still send your questions to our social media platforms and they will be answered immediately.
You are watching the DocTalk Show.